Okay, so good afternoon, everyone. I think we'll get started. So you're very welcome to this session on exercise and cancer. A huge thank you to the Irish Cancer Society for inviting me along today to deliver this workshop. So for the next half an hour or so, we're going to talk about why physical activity is important and how we could potentially view it as exercise as medicine in the treatment and management of different clinical conditions. And we'll talk about what we mean by exercise specifically and how much we should be engaging in order to benefit our health. And then the second half of the session, I just wanted to focus on some top tips for being regularly physically active, and then to give some suggestions of exercises that you could do at home to support you meeting the recommended physical activity guidelines. But just before we jump into that, I just wanted to tell you a little bit about who I am and what it is that I do. So my name is Mairead Cantwell, and I'm a clinical exercise physiologist. So that means that I work in the promotion and prescription of exercise to optimize the health and well-being of individuals living with different chronic conditions. At the moment, I'm working as an assistant lecturer in Athlone IT, and in that role, I'm teaching students about the structure and function of the human body, how that changes in the context of disease, and how exercise can help. I'm also one of the very lucky PhD students to have been funded by the Irish Cancer Society. So I completed my PhD in Dublin City University last year, and as part of that project, I developed, implemented and evaluated a 12-week exercise program for individuals who had completed their cancer treatment. So I'm continuing to do research in the area of cancer and other clinical conditions, and I'm doing that as part of the SHE research group at Athlone IT. And just to touch on the research that I did as part of my PhD very briefly, if anyone is interested in it, I'd love to chat to you more about it. There's very limited research in the Irish context in this area. So we did a couple of studies, and we were very lucky to have much of this research published in scientific journals. So what we did first was that we spoke to healthcare professionals about their practices in relation to promoting physical activity. And then we spoke to individuals about their experiences of physical activity across their cancer journey. And we used what we learned from those two studies to develop a 12-week exercise program. And we delivered that at Dublin City University, and we followed participants for a 12-month period. So would love to chat about that in more detail if anyone is interested, and my contact information is available at the end of today's presentation. But coming back to physical activity, let's talk about why it is important. So we know that being physically active is one of the most important steps that people of all ages can take to improve their health and well-being. And why is this the case? Well, it's because we know that exercise increases what we call our cardiorespiratory fitness. And our cardiorespiratory fitness is a measure of how efficient our heart and our lungs are at providing energy for exercise. And we know that this is one of the best predictors of our health overall. And the research tells us that individuals who are fitter live longer. And in addition to this, we also know exercise has lots of other benefits. So it can reduce the risk of cancer coming back. It can assist in managing treatment-related side effects following cancer treatment, such as managing fatigue. And it can also help to improve our mood and reduce symptoms of anxiety and depression. When we look at its impact on other chronic conditions, regular exercise can lower the risk of developing heart disease, developing type 2 diabetes, or having a stroke. It also plays a really important role in terms of helping us to maintain a healthy weight, and it can support us to optimize our physical function. And ultimately, all of this combines to maximize our quality of life overall. And so in this way, we can see that exercise is medicine. So someone might take a tablet to lower their cholesterol or to lower their blood pressure. But exercise is what we call a poly pill. No, not only will it lower your cholesterol and lower the blood pressure, but it will have all the other benefits that we've spoken about. And so in that way, we refer to exercise as medicine. And so with that in mind, we all need a daily dose of it in order to benefit our health and our well-being. But specifically, what are we talking about when we talk about exercise and physical activity? And oftentimes these terms are used interchangeably, but they are different. So physical activity is more an umbrella term for all the types of movement that we can have in our day. So the first category within physical activity is really active living. And that's just general movement that we do as part of our day, doing jobs around the house, walking to and from the bus, and just general movement as part of everyday life. Exercise then is structured and it's purposeful, and it's done repeatedly in order to optimize what we spoke about there, our cardiorespiratory fitness. So there's generally a higher intensity component associated with structured exercise compared to active living. And then we have sport. So sport has a skill component to it and a competitive edge as well, but shares many similar features to structured exercise in that it typically improves our fitness and that intensity is associated with it as well. So how much physical activity should we be doing in order to benefit our health? So if we go back to our idea of exercise as medicine, if exercise is the medicine, well, what's the prescription? What's the dose? And the message really is that every single step counts. Every second, every minute, every hour of physical activity that we do does benefit our health. But there are recommendations around the minimum amount that we should be trying to achieve. And this will differ for everyone, and we'll come on to talk about that in a little bit more detail. But these recommendations were put forward for the general population. So for adults between the ages of 18 and 64. And the recommendation is that we should be achieving at least 30 minutes a day of moderate intensity activity on at least 5 days each week. So that equates to 150 minutes a week. And you'll see in the smaller text there in the middle of the slide that we also need to be including activities that increase our muscular strength and endurance on at least 2 days each week. And we're going to come back to look at this in a little bit more detail, but as I've said, these guidelines are put forward for the general population. But when we look to the scientific literature for individuals who've had a diagnosis of cancer, the recommendations are still the same. We should be aiming to achieve at least 150 minutes of exercise each week where possible, and to include exercises that optimize our muscular strength on at least 2 days each week. There is also the recommendation here that after an individual has received a diagnosis, that the goal is to avoid inactivity and to return to normal daily activities as soon as possible. It's also really important that we be mindful of reducing the amount of time that we spend engaging in what we call sedentary behaviour. So this is prolonged periods of sitting. That might be sitting on your couch or sitting at your computer, or like we are now sitting and watching this session. But it's really important that we break up those prolonged periods of sitting with bouts of activity, and that we include exercises to build our strength and improve our balance as we age as well. So I just wanted to offer some, the scientific literature tells us about strategies that we know are what we call evidence-based, that they're proven to help us make physical activity part of our everyday life. So I just wanted to share some of these with you. So we know that being physically active with friends and family makes us more likely to stick with physical activity in the long term. And remember, exercise is medicine. It's going to benefit everybody's health. So try to make it social, be active with friends and family where you can. We know we're more likely to stick with exercise when it's something that we enjoy. So, if you're not someone who enjoys going to a gym class, don't make yourself commit to that if that's not something that you're going to stick with in the long term. Find an activity that you enjoy. Consider trying something new if you haven't done something before. But finding the exercise or the type of exercise that you enjoy is going to help you to stick with it in the long term. Again, try to make it a habit. Incorporate more activity into your daily life. Small changes make a really big difference. So breaking up those prolonged periods of sitting, maybe taking the stairs instead of the lift, or including what we call physical activity snacks throughout the day. So breaking your physical activity up into smaller bites of 5 or 10 minutes throughout the day. And I'll come back to talk about that one in a little bit more detail as well. Find out what opportunities are available in your local community. Maybe join a club or a group. Again, that social aspect is really important. And share your plans with people who are going to support you to make physical activity part of your everyday life. And if you're not sure what's available in your local area, this is a fantastic website. It's called Get Ireland Active. And you can see there they have a search engine where you can type in your county and the type or category of physical activity options that you're interested in. And it's not an exhaustive list. It doesn't list everything, but it does include some suggestions of services or programs that might be available in your area. And much like, if you were trying to eat a healthier diet and you might make a goal that you want to lose 5 pounds, or you might keep a diary to record the food that you're eating over the course of the week, these strategies also work in the context of exercise. So setting yourself a physical activity goal, in 8 weeks' time, I'd love to be able to walk 5 kilometres, or I'd love to be able to do a 10K with my friend in 3 months' time. We know that writing down the amount of physical activity you do can help you to, really just visualize what it is you're achieving over the week, and maybe help you to see where you sit in relation to those recommended guidelines of 150 minutes each week at least, and the 2 strengthening sessions for our muscles as well. But just coming back to those guidelines, so as I mentioned, in the context of cancer, the main advice is that after you've had a diagnosis, try to avoid inactivity and return to normal daily activity as soon as is possible. And simply put, we just mean moving more as part of your daily routine. And everybody will be at different stages of their cancer journey, and at some stages, it might be challenging enough to just get through the tasks of everyday life, washing, dressing, and that's not the time that you need to be increasing your physical activity. But where possible, avoid inactivity. Just move more generally as part of your day. And when you feel ready, then, just to give a bit more in relation to moving more as part of your everyday, do jobs around the house that require energy, that increase your heart rate, and maybe try to walk where you can. But when you are ready to increase your exercise and get up to those guidelines, when we talk about that 150 minutes a week, what we're talking about is whole body exercise. So that's exercise that uses all of the large muscle groups. So that's our cycling, our swimming, dancing, walking, those types of activities. And they should be done at what we refer to as moderate intensity. So how do you know if you're exercising at a moderate intensity? Well, we should have a red face, we should be sweating somewhat, and we should be short of breath. So how you can gauge that is use what we call the talk test. So are you able to hold a conversation with someone? You should be catching your breath somewhat, but you definitely shouldn't be able to sing while you're doing your exercise if you're exercising at a moderate intensity. So that can help give you a little bit of an indication to where you're at in relation to that. Just coming back to this notion of physical activity snacking, so the 150 minutes can be broken down to 30 minutes on 5 days of the week, and then further broken down where you might do 3 bouts of 10 minutes throughout your day. So 10 minutes of exercise in the morning, 10 at lunch, and 10 in the evening. So, thinking of it as these small portions of exercise. Some of you might have watched the Operation Transformation, and they had a great initiative there where they did the ad break challenge. So, if you're watching a program of an evening time and the ads come on, do 3 minutes of an exercise to get that heart rate up and break up those prolonged periods of sitting. For some people, they really enjoy counting their steps rather than focusing on the number of minutes of exercise they do each week. And there's lots of tools that we can use now. You can see in the picture there on the side of that lady's jeans is what we call a pedometer, and that can be used to count steps. And then there's also things like Fitbits. You can get an app for your phone to help track your daily step count. But it is recommended that we should be achieving a minimum of 10,000 steps each day in order to optimize our health and our well-being. And then I really wanted to focus on this session. So this is strengthening exercise activity guidelines unfortunately doesn't get as much airtime as the 150 minutes a week. That tends to get a little bit more attention. But the strengthening exercises are equally important, and they're really important for maintaining our muscle mass. And particularly as we age, that's hugely important in terms of maintaining our functional capacity and our independence to do tasks of everyday life. So with that in mind, I would like you to get involved with me at home if you can. So we're just going to go through a couple of exercises that you can do at home. These are the exercises that I'm talking about when I say muscle strengthening exercises. So the first one is our sit to stand. So I hope you can see me here. I'm just going to move my camera down a little bit. So when we're doing any of these exercises, the first thing that we need to do is really just check in with our posture. So I'm going to ask you just to check in with your body, just to make sure that your shoulders are directly over your hips. So our back should be nice and straight, that we're keeping our head looking straight in front. So our chin should be parallel with the floor. So not to have the head leaning up or the head leaning down, but the chin should be parallel with the floor. I'm going to ask you to engage your core. And what I mean by that is just to squeeze those tummy muscles nice and tight. So that makes sure we have a really nice stable basis of support for starting our exercises. If your balance allows, I'm going to ask you to place your arms across your chest like this. If you're a little bit unsteady on your feet, you can have the arms out in front, or you can use the side of the chair for support. But if you cross the arms across the chest, we're going to come up to standing, and we're going to lower back down to sitting. Again, depending on your level of physical ability, you might decide to sit on the chair, or you might decide just to touch off the edge of it. Or if you feel confident enough to, you can loose the chair altogether. And when we do this movement without the chair, we're actually engaging in a squatting exercise. So this is really beneficial for the muscles in the lower limbs. So we're going to practice this one for 10. So I'm going to ask you again, just check in with the posture, make sure the shoulders are over the hips, that we're activating those core muscles, arms across the chest if we can, but use the chair for support if you need to. And when we're ready, off we go for 10. Nice, slow and controlled actions is what we're looking for. So really taking our time with this. We really should be mindful about our breathing as well. So we're breathing out on the effort. So the effort is when we're standing up. So breathing in on the way down and breathing out on the way up. Going to do 3 more. 1, 2, and 3. That's a really great exercise to focus on the muscles in the lower limbs. And you could progress that as you feel you're getting stronger. You could lose the chair and do it as a freestanding squat, as I mentioned. And then as you get fitter again, you might decide to incorporate some upper body exercise with it as well. So you might incorporate a bicep curl. So as we're standing, we're bending the arms and coming back down to a sitting position. And the next one that I wanted to give a try is our bicep curls. So just 2 tins of sweet corn, 2 bottles of water, whatever you have in the press at home, but just a little bit of weight. You don't have to go out buying weight specifically. Whatever you have at home you can use. And again, we're going to check in with our posture. So we're making sure that the shoulders are over the hips, that we're activating those core tummy muscles, so squeezing them nice and tight, and holding a bottle of water or 2 tins of soup, whatever you have at home. We're going to have the palms of the hands facing out. We're going to bend the knees slightly. So I don't want you to have your knee locked out completely straight. There should be a little bit of give in the joint. So just a little slight bend in the knee. When we're ready, we're going to bend the elbows, bringing them up to the shoulder height and lowering them back down again. Same with this one in terms of breathing. We're breathing out on the effort. Okay, so as we lift, we're breathing out and breathing in on the way down. So when you're ready, I'm going to ask you to join me for 10. So off we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Great stuff. Going to move on to the next one. This is again another one for the lower limbs. Okay, so if you're doing these exercises at home, it's a really good idea to alternate. So we started with a lower body exercise doing our sit to stand, and then we did an upper body. Now we're going back to a lower body exercise. So we're not stressing the same muscle group repeatedly. We're giving the arms a chance to recover. So with our lunges, again, we're going to check in with our posture. So we're going to make sure that the shoulders are directly over the hips, our back is nice and straight. We're activating those core tummy muscles, squeezing those nice and tight. Again, if balance allows, I'll ask you to pop the hands on the hips. And if you're a little bit unsteady on your feet, you can just have a chair beside you for support and just holding on to the back of that. But what we'll do is we'll place the hands on the hips. When you're ready, you're going to take a step out in front, and I just want you to bend that front knee, and we're just sitting down into the lunge. As we bend the knee, it's really important, you can't quite see my toe there, but our knee shouldn't go past our front toe, okay? If we are, we're putting a little bit too much stress on that joint. So we're bending the knee down and coming back to where we started. Okay, so I'm going to ask you to do 5 on each leg. We'll start with the right leg. So again, checking in with your posture, taking a step out in front, bending the knee, and coming back to where we started. So 4 more on this side for 4, 3, 2, and 1. Changing over to the left leg for 5, 4, 3, 2, and 1. How many of you are still activating that core? It's easy to forget it. There's a couple of different things that you might be focusing on when you're doing that exercise. So don't forget, really important to activate those core muscles. I'm going to move back then to an upper body exercise. So I'll just do this one seated so that you can see me a little bit more clearly, but I'd ask you to do it standing if you can. So sitting or standing, we're going to keep the shoulders over the hips. So checking in with that posture again, activating those core tummy muscles, squeezing them nice and tight. Taking our 2 bottles of waters or 2 tins, whatever you have at home, and we're going to have the palms of the hands facing down. We're going to raise the arms up in front, and we're only going as high as our shoulder, no higher than that. We're going to lower the arms back down, and this time we're going to bring them up to the side for a lateral raise. Again, we're just going to shoulder height and down. Okay, so we're coming up in front to shoulder height and down, and out to the side, up to shoulder height and down. So when you're ready, I'm going to get you to join me for 10. We're going to do 5 in front and 5 to the side. So off we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Well done. And the last one that I wanted to show you is our tricep dips. So these are the muscles on the back of the arm. Again, the bicep gets a lot of airtime, the tricep dip, the tricep muscle, not so much. Again, I'll just do this one seated so that you can see it a little bit more clearly, but I'll ask you to do it standing if you're doing this at home. So what we're going to do is we're going to bring the arm up beside the ear. We're going to bend the elbow, okay? Again, checking in with the posture, making sure that we're nice and straight. We don't want to be hyperextending our back. Protecting our back is the most important thing, and activating those core tummy muscles helps with that. Once we have the elbow up beside the ear, we're going to straighten out the arm up to the ceiling, and when we're ready, we're going to go for 5. So 5, 4, 3, 2, and 1. We're going to change over to the opposite side. So same again, checking in with our posture, raising the arm up beside our ear, bending the elbow, reaching up to the ceiling for 5, 4, 3, 2, and 1. Well done. I think I did include a bonus exercise. This one is our upright row, so I'll have to show you this one in standing, so hopefully you can see me okay. So for this one, what we do is we start with our feet about shoulder width apart. Again, slight bend in the knee, so not locking that knee out completely, slight little bit of give. Checking in with the posture again and activating those tummy muscles. This time we're taking our bottle of water or a tin of soup or whatever we're using at home, and we're going to bring the arms as close to the body as we can, and we're going to point the elbows up to the ceiling, okay? We're just coming up to chest height, so no higher than the chin, and coming back down to our starting position. Just going to turn sideways. Really important that we're keeping the weight as close to our body as we can, okay? So not to see it out here and going up like that, but running it up the center of our body. And again, just coming up to the chin and no higher. So when we're ready, we're going to go for 10. Remember, a slight little bit of give in the knees, and off we go for 10, 9, 8. Remember our breathing. So we should be breathing out on the effort. Okay, so breathing out, breathing in. 5 more. 5, 4, 3, 2, and 1. Brilliant stuff. So I hope you found those exercises helpful. As I mentioned, you know, the 150 minutes of whole body exercise, our walking, our cycling, our swimming, it's so important for our health, but doing muscle strengthening exercises that optimize our strength is equally, if not more important. And it's really important that we're including them on at least 2 days each week in order to optimize our health. So just in terms of some take-home messages from today's workshop, it's really just to say that something is better than nothing. Remember, avoid inactivity where you can. If you're new to being physically active, start off small. Your first couple of goals might be that you want to reduce the amount of time that you spend sitting, and you want to incorporate some physical activity snacks throughout the day. So whether that's doing your ad break challenge, doing 10 sit-to-stands during the ads, or whether it's, you know, taking the stairs instead of the lift, make those small changes first and gradually increase the amount of exercise you do over time. But really, it's just about moving more in a way that you enjoy in order to optimize your health and your well-being. So that's great. That's everything from me. I'm happy to take any questions if anyone would like to ask anything.
Hi, Mairead. Thank you so much for that presentation and for the practical demonstration as well. That was fantastic. I would remind anybody who's watching that recordings of sessions will be available. So particularly useful for this presentation if you want to practice those exercises, and you will be getting an email with links to the sessions. So that will follow. It'll be really easy to do. We do have a couple of questions, Mairead. So I'll start. First of all, Aidan has asked the question, after a cancer diagnosis and when you're finished treatment, is it a thing that you should be doing your regular exercise, or should you be challenging yourself? So should you be upping it? Should you be doing like regular exercise every week, or should you constantly be challenging yourself?
I think that's a little bit of a challenging question to ask when I don't know Aidan and his context and his ability. But what I would say is the goal would be to try and work towards achieving those physical activity guidelines. And that's taking into account, you know, maybe the side effects that he's experiencing. You know, lots of people come to us talking about the cancer-related fatigue. And while there is an element of, you know, you need to be trying to combat that and increasing your activity, we also need to listen to our body as well and not push ourselves too much. So it's to try to get that balance. But I'd encourage him, if he's finished his treatment and he's feeling well, I would see where he is sitting in relation to achieving those recommended guidelines, at least 150 minutes each week and 2 strengthening sessions. And I'd work towards achieving that in a gradual way. So, you know, if he's doing half that 75 minutes at the minute, you know, increase it by 15, 20 minutes each week and work up to the 150. It's really important that you do it in a gradual and kind of progressed way rather than just jumping into it straight overnight. But yeah, I hope that answers this question.
Okay, perfect. So you've talked a lot about guidelines, and I know you've referenced the American Cancer Society guidelines. Are those the kind of things that patients should be looking at in Ireland, or are there any other websites or sources? I know there's Healthy Ireland and a couple of other websites that they can log on to. Is there anything in particular you'd recommend?
Yeah, so unfortunately, Ireland don't have guidelines like the American Cancer Society have in relation to physical activity. There aren't any Irish specific guidelines for that. We follow the American Cancer Society's recommendations. The American College of Sports Medicine have some excellent recommendations around exercise and cancer, and that's published. I'm happy to share that if that was something that you wanted to share with anyone who's on joined today's talk. And there's a group in Australia called ESSA. It's Exercise and Sports Science Australia, and they have really, really helpful handouts. It's generally one A4 page front and back, and it talks people through the recommendations for physical activity and ways that they can achieve that at home. So yeah, the American College of Sports Medicine and Exercise and Sports Science Australia have some great resources. So giving both of them a Google would definitely be worth a go.
Okay, fantastic. We've also had another question in from Dorothy. So she loves walking. She has finished her cancer treatment, but unfortunately she's suffering from ankle pain because of one of her cancer drugs. It's making it really difficult for her to walk as much as she'd like to, and she's just wondering, is there any way around this?
Yeah, really great question, and I think that's experienced by a number of people. It can be a common side effect, and yeah, people can be unsure how to overcome that. And my advice will be to switch to what we call non-weight bearing exercise. So that's exercise where we're not putting any loading on the joints. So things like swimming, or if she had access to a bicycle or a stationary bike, you know, ones that you might see in a gym. And that type of exercise is still that whole body exercise that we're talking about, that we're trying to get 150 minutes in. And that type of exercise will minimize the loading on the joint, and hopefully she won't experience that ankle pain on exertion. So non-weight bearing exercise, so stationary cycling, swimming, or out on a bike in the fresh air either.
Fantastic. Okay. Lots of thank yous coming in here as well, Mairead, just FYI. We have another question here, and it's about cycling actually. It's Sylvia is asking, have you any particular advice for patients who have had lymph node clearance? So she's thinking in terms of lymphedema. She's been told not to cycle and she is walking, but she's wondering, can she cycle now and then?
If her advice, if the guidance from her healthcare professional has been not to cycle, I would stick with that. Again, you know, a lot of these questions would be based on each individual, and it's difficult to comment if you don't kind of have the full picture. So my advice would be to stick with what our healthcare professional has advised.
Okay, that's fair enough. I have a question around your top tips. So they were really helpful. I'm just thinking of the coming months, and I suppose the difficulty of getting out and being motivated to get out in those dark, dreary November evenings, but also the challenge of potentially us going back into lockdown, or maybe patients or cancer survivors having to cocoon again. Have you any, this is a tough question, but have you any top tips for that kind of scenario where we can't get out maybe, or we can't get out and meet other people as much as we would like to?
Yeah. So I'm not sure if anyone here has heard of Cantwell Medical, but it's a program run by Dr. Noel McCaffrey. My PhD research was based on the program that's available as part of Cantwell when it was based at Dublin City University, called Move On, and that was for individuals who had completed their cancer treatment. But Cantwell is offering home-based programs and home-based solutions, and they are doing some sessions online, and so individuals who are interested in joining a group program like that, it can be accessed remotely, and I know they are transitioning somewhat back to some face-to-face sessions. The clinic itself, the main clinic is based in Santry, but there's lots of other sites opening up around the country. I know Sligo have one, Limerick have one, and Tala have one, Loughlinstown, so they're popping up all over the place. So I'd encourage you to contact your local centre and they'd be able to advise you what's available from them. But, you know, trying to get a combination of that social aspect is really important. So, you know, they're offering classes online where you're still able to interact with others. And it's offering that evidence-based care, you know, the types of exercises that are appropriate for individuals living with different chronic conditions. And so if anyone is interested in that, I'd encourage them to get in touch with Cantwell Medical. Again, their details will be available online. And other solutions, you know, would be to access, you know, other online classes that might be available. Lots of exercise instructors are delivering sessions remotely. And I think, you know, trying to incorporate that social aspect and that commitment, you know, if you know you signed up for a yoga class that's at 6 o'clock on a Tuesday, it's really good to have that penciled into the diary. Like you say, when the evenings get dark and dull, it can be harder to motivate yourself. So I think making that commitment can be really powerful in terms of making you stick with it through the winter months.
Yeah, I think you're so right. You need that discipline to motivate yourself, especially on those dark evenings when you just want to curl up on the couch.
Yeah.
I assume a lot of those programs have a fee. Is there any free resources out there? Or I'm thinking of maybe there's lots of different YouTube videos. Is there anything in particular that you would direct people to? They can obviously rewatch your presentation and do the exercises with you as well.
Yeah, definitely. Again, you might have a look at the Exercise and Sports Science Australia website. I'm not sure if they have exercise class videos available online, but unfortunately, those types of resources generally have a cost associated with them. I'm not familiar with any kind of evidence-based ones that I would formally recommend.
Okay, even that is really, really good to know, because, you know, you don't want the scenario that somebody is following maybe something that's not evidence-based and risking injury as well.
Exactly. Yeah, I'd be encouraging anyone who is interested in becoming more physically active to make sure that the recommendations they're getting, you know, that they're evidence-based, that they're based on research, and that they're appropriate for where they are in terms of their cancer journey.
Yeah. Kevin O'Hagan is our cancer prevention manager, and he has just shared a link with the group there on the chat if people can see it. So he's just reminding us that there is information up on our website, cancer.ie, and if you click on the link that he has shared, it will bring you straight in, and it's talking about exercises that you can do at home. So very much suitable for the challenge of COVID. We have a COVID-related question now. So somebody has asked, how safe is it to go swimming during COVID-19?
I'm not sure that I'm maybe the best person to answer that question. I think, you know, people can be at different stages of the cancer journey, and depending on the treatments that people can be on, there can be a degree of immunosuppression. So yeah, I probably wouldn't feel comfortable answering that one. I wouldn't be an expert in the context of COVID and the recommendations around that. So I'm not sure, maybe if contacting the HSC, they might be able to offer some more appropriate guidance in relation to that.
Yeah, I think that's an excellent answer. And I think really for those sort of questions, you'd have to ask your own healthcare professionals for their advice. Yeah. And the advice may vary depending obviously on treatment.
Situation, yeah.
So whatnot, or restrictions indeed that are in place with COVID. So I think, yeah, that's very, very specific. Thank you. Okay, we don't have any other questions coming in at the minute. I see that Kevin is just reminding us of that there are daily online exercise classes specifically tailored for people who may be cocooning at home, and he's sharing links and where to access them. So if anybody's interested in that, please get on there. Mairead, is there any kind of take-home messages? You've given us those, but just based on the questions that you're getting in there, and is there anything in particular that you wanted to flag up to people before we finish up the session?
Yeah, I think the take-home message really is just move more in a way that you enjoy. You know, if exercise, going to gym-based classes, if that's not for you, don't make yourself go down that road. go with the active living. You know, we talked about physical activity under that umbrella. We talked about active living, structured exercise and sport. You know, for some individuals, active living might be the way that they want to accumulate their physical activity on a daily basis. And that's perfect. You know, try to go with the option I think that you're most likely to stick with in the long term. You know, and just like we talked about that analogy of exercise as medicine, we need to get a daily dose of it if we're going to try to optimize our health and well-being. So trying to incorporate as much physical activity as you can throughout the day, and working towards achieving those guidelines.
Fantastic. Thank you so much. Just in case people have come in at the very end there, just to remind you that this presentation is available. It has been recorded, so you will be able to look at it at a later date, and you will be able to do those exercises again that Mairead went through with us. So there is absolutely no excuse. If anybody has any further questions, Mairead's contact details are at the end of her presentation slides, and she has very generously said that she is available for questions after this session if required. We're not seeing anything else come in, so we're pretty much bang on time, which is fantastic.
Great.
So we will wrap the session up there. And Mairead, thank you so much for the energy that you brought to us all this afternoon. And you've definitely inspired me to get up and get out later on. So thank you.
Oh, great, Aoife, no problem. And listen, just a word of thanks for me. It's lovely to do these sessions. I really enjoy them. And, you know, I was very lucky to have been a PhD student who was funded by the Irish Cancer Society. So to everyone tuning in here, if you've ever donated to the Irish Cancer Society, some of that funding would have gone to support the work that we did. And I just can't thank you enough, because it's just been fantastic to get this research out there in the context of the Irish setting. So a very big thank you from me.
Brilliant, Mairead. Well, it's great to see it come full circle and it being delivered back to the people who need to hear it. So well done you.
Thanks, Aoife.
All right. Thank you. Thank you, everybody, for tuning in. Thank you.
Thanks, everybody. Take care. Bye-bye.
Bye.